So my name is Farah Rahman. I am a second-year medical student at Loyola Stritch School of Medicine. And prior to starting medical school, I completed my MPH in health policy at the Yale School of Public Health. It is called the Allied Community Engagement Together in Our Neighborhood project, or ACTION is just less to say. I had the concept of doing my voter registration drive at 3 Loyola Family Medicine clinics. One is in Maywood and serves a predominantly African American population. One is in Gottlieb, or it's called Gottlieb Memorial Clinic, and serves a predominantly Latinx population. And one is Elmwood Clinic and serves a niche Italian immigrant community. The idea is to register folks to vote in family medicine clinics because I believe it is a really good catchment area for first-time voters and minority voters who may not be registered to vote. The whole point is the documentation you bring with your doctor to your doctor's appointment is the same documentation you need to register to vote online. So your license or identification and your social security number. Illinois is a great state to do this in because we are very voter friendly. We're there as a nonpartisan effort just to help people who would like to be helped. With my background in public health and health policy, I'm pretty acutely aware that voting disparities exist. And with further research, I was not surprised to see that when there's a disparity in who is voting, there is a disparity in the representation we see in local and larger governments. So minority, racial and ethnic minority populations are not represented on a larger scale. And we obviously see this when it comes to the House, the Senate. It is blatantly obvious in those places, but where it's, I guess, less obvious is in local government. The Pew Research Center in 2016 found that the main barrier to civically engaging people in the United States is the voter registration process. So if we can overcome getting folks registered, we are more likely to get them to actually cast a ballot. I knew I wanted to register minority groups, and where would I find them? Well, most people, regardless of literacy, citizenship, ethnic, religious background, go to a doctor's office. And so for various reasons, I thought a doctor's office would be a great place to intercept this negative feedback. There's a lack of transparency, in my opinion, in the whole civic engagement process. Whatever it takes to build that level of trust and rapport with the patients is something that I was willing to do because I do understand that it's a very sacred right that has been fought for through generations to exercise this right to vote. This idea was created my M1 year. I worked with the League of Women Voters to do training sessions and train medical school classmates on how to appropriately register someone to vote within Cook County. We had up to 50 interested volunteers. Beyond that, we had to have some COVID safety guidelines. So if you are quarantining, obviously, please do not come for your volunteer shift. First thing you do is get your temperature checked by the medical assistance staff. Masks are required, gloves you can do. We sanitize our laptops and ID cards that we hold on to for our patients. So the first thing we do is get our temperature checked, get set up. So at this point, we are giving out a ton of swag, I would say. So free stickers for anyone who registers to vote. They say different fun things on them. We also have free shirts for our patients at this point. We can help register to vote, help apply for the mail-in ballot, and answer any questions anyone may have about this election cycle. We just approach patients while they're waiting for their doctor's appointment. If they are interested in checking their voter registration status, if they have a voting plan, if they would like to apply for mail-in ballot, many options to ask. We are only in Maywood 4 days a week, and we try to be there from 9 to 6, but it just depends on student scheduling. So one of my favorite ones was actually a young man who had a past history of a felony on his record. and he didn't think he was able to register to vote or participate in the civic engagement process. And so he said, "I never had the opportunity to look into if I was able to vote. When I was going through my situation with my felony, I never knew I had the opportunity. Now that you guys were able to help me out, I know I do have a voice." Illinois is one of the few states that gives rights back as soon as someone is no longer within the system of corrections. We had someone say, "Let me ask you, if someone wasn't registered to vote, is that something they could do right here? That's so amazing. It's something people don't really think about. So it's great that they can do it here so quickly." Of our 148 survey takers, 93 were already registered to vote. But of the 53 that weren't registered, we registered 48 of them. So it computes to like 87%. So we as medical students and public health practitioners were able to have some really fantastic conversations regarding mail-in voting. What does it look like? What will happen to your ballot? If you are able to vote on other days, if you're able to vote early, if you are comfortable with mail-in voting and you have pre-existing conditions, as you may coming to a family medicine clinic, you should consider other options if that is something that you are comfortable with. This past summer, my parents, who are also healthcare providers, contracted coronavirus, and we had a very tough summer dealing with that. So for whoever is listening and whoever is considering voting in person and considering taking that risk, I would really ask to think quite a few times about that. And if there's still time, please get the mail-in ballot. Please vote early. Pick off hours to vote. This election is not like elections before, and no one should have to choose between their health and the democracy. Action is partnering with Patient Voting, which is a similar organization under Dr. Kelly Wong, and that is about bringing absentee ballots to our patients in the hospitals. So we will be shifting gears to be more inpatient at that point. Action and Citizen Physicians is working with Patient Voting to gather volunteers to run these ballots to their patients. And so we have to collect them and then drop them off to the election authority. I actually was born in India, and so I became a naturalized citizen back in early 2016. And so my first time voting was the 2016 presidential election. Being able to exercise my right to vote and my voice for those who can't is a very important responsibility. And that was before I became a physician. I'm not a physician. As a physician in training, we can only grow stronger as an organization or as a country when we understand where other people are coming from.
Hello, Impactful Chats fans. This is Mark Shapiro here. I'm a hospitalist and the host of Explore the Space podcast. I am grateful to Malin for sharing her mic with me for a moment to talk about the Morning Report initiative with Vote Health 2020. Through my years in medical school, residency, and as an attending, I could count the number of conversations that I have had about voting with fellow medical students and residents and physician colleagues on one hand. Somehow it's become normal for us to not help mobilize and energize one another around voting. And this has cost us dearly. Physicians vote at a rate that is 9% less than the general public, 22% less than attorneys. This November 3rd, there is a presidential election. But remember, your ballot will be filled with so much more. State elections, local elections, bond measures. You may be electing your local sheriff or deciding on a measure around carbon offsets in your county. The issues and initiatives that impact our communities and the lives of those that we care for are not hearing our voice and feeling our impact. It's time that we change that. The process is simple. Check your eligibility to register and get registered to vote. Then decide if you'd like to vote absentee or mail-in. They mean the same thing. And check the deadlines for your state. If you're planning to vote in person, make a voting plan. This is critical for us in medicine. Check your work schedule, talk to your teammates, discuss how you'll cover for one another to ensure everyone can get to the polling place on election day. Then cast your ballot. I've chosen to vote absentee this election because I'm working on election day. Take a look at this slide. It's got everything you need to move through these steps in one place, and it takes just a few minutes. We want to bring this message far and wide. The Morning Report Initiative with Vote Health 2020 is here to help do just that. If you'd like to have me or another physician on our Vote Health 2020 team join any meeting you've got virtually, we'll be there. Morning report, grand rounds, team huddles, you're having a coffee with some pals, anything. Just email info@votehealth2020.com to schedule. We'll set up a free, less than 5-minute presentation that is nonpartisan and has everything your audience needs to get activated. You can also check out www.votehealth2020.com. No excuses this election and going forward, my friends. Thank you all so much for what you do, and thank you, Malin, for letting me come on and talk about this.